Hello and welcome. Today we're going to explore two big questions. What exactly is a psychological disorder, and what is psychotherapy? Both words are used all the time, but they're often misunderstood. Some people think a psychological disorder just means being crazy or weak. Others assume psychotherapy is only for people who've completely lost control, but both of those ideas are wrong, and actually they stop people from getting help that works. So let's start from the beginning. What does it really mean when we say someone has a psychological disorder? Human beings have an incredible emotional range. We all feel sadness, fear, anger, guilt, and even moments of despair. These emotions are not signs of illness, they're part of being alive. They help us survive, connect, and learn. Feeling anxious before an exam or sad after a breakup isn't abnormal. It's appropriate to the situation. But sometimes, emotions become overwhelming, constant, or disconnected from what's happening around us. When our inner experiences, our thoughts, feelings, or behaviors start to cause real suffering or make it hard to function in everyday life, that's when we begin to speak of a psychological disorder. In psychology, we often describe a disorder as a pattern. It's not about a single bad day or a temporary phase. It's about consistent experiences that don't go away on their own and that make it difficult to work, maintain relationships, or take care of ourselves. For instance, feeling anxious before a presentation is normal. But if anxiety becomes so intense that you stop leaving your house, avoid social situations, or constantly expect disaster, that might signal an anxiety disorder. Or take sadness. We all feel it sometimes. But when sadness turns into a deep, lasting loss of energy and pleasure, when it colors everything you see, that might indicate a depressive disorder. The key difference is degree, duration, and distress. A psychological disorder is not about what someone feels, but about how intense, persistent, and impairing that feeling becomes. Another crucial point is that what counts as disordered isn't just defined by biology. It's also shaped by culture and context. Every society has its own ideas about what's considered normal. In some cultures, hearing the voice of an ancestor might be seen as a spiritual experience. In others, it might be labeled as a symptom of psychosis. So when professionals talk about psychological disorders, they try to consider not only symptoms, but also the person's background, culture, and life circumstances. Unfortunately, stigma still plays a huge role. Many people hesitate to seek help because they fear being judged or labeled as mentally ill. But here's the truth. Psychological disorders are health conditions, not moral flaws. They're as real as diabetes or asthma. They just affect the mind and behavior instead of blood sugar or lungs. And like other health conditions, they have causes, courses, and treatments that are well studied by science. Psychologists and psychiatrists have spent decades trying to describe and classify these conditions in a way that helps people get the right help. That's where diagnostic systems come in, specifically the ICD and the DSM. The ICD, which stands for International Classification of Diseases, is developed by the World Health Organization. It's used around the world to classify all kinds of health problems, not only psychological ones. The version most commonly used in clinical psychology today is the ICD-10, although a new version, the ICD-11, is already being introduced in many countries. The DSM, or Diagnostic and Statistical Manual of Mental Disorders, is created by the American Psychiatric Association and is mostly used in North America, but it has a big influence on research and education globally. Both systems aim to describe disorders clearly and consistently. They outline which symptoms need to be present, how long they should last, and how much they should affect someone's daily life before a diagnosis can be made. This helps professionals around the world speak the same language, so that when one clinician says major depression, another knows exactly what that means. For example, according to both systems, a depressive disorder involves symptoms like a persistently low mood, loss of interest or pleasure, sleep disturbances, fatigue, and difficulty concentrating, lasting for at least 2 weeks and clearly interfering with everyday functioning. That's very different from simply having a rough patch. Of course, people are more than their diagnoses. A diagnosis is a tool, not a label that defines who you are. It helps guide treatment, track progress, and communicate with other health professionals. But it should never reduce a person to a set of symptoms. Psychological disorders are complex. They develop from a mix of biological, psychological, and social factors, what professionals often call the biopsychosocial model. For instance, someone might have a genetic vulnerability to anxiety, but that vulnerability only turns into a full-blown disorder if it combines with chronic stress, unhelpful thinking patterns, and a lack of social support. This understanding is important because it shows that mental health problems are multi-layered. They're not caused by just one thing, and they're not permanent or inevitable. They're the result of how our brain, our mind, and our environment interact, and that means they can change. So, to sum up this first part, a psychological disorder is a recognizable pattern of experience in thoughts, emotions, or behaviors that causes significant distress or impairment and can be understood and treated scientifically. It's not a personal weakness, not a character flaw, and not a life sentence. Now that we've clarified what a psychological disorder is, let's talk about what can be done to help. In other words, what psychotherapy really means. The word psychotherapy literally means healing of the mind. But in modern psychology, it refers to a structured, evidence-based treatment that helps people understand and change the patterns that cause suffering. It's about working with a trained professional who uses scientifically grounded methods to promote psychological well-being. There isn't just one kind of psychotherapy, there are several, each with its own theory of how change happens. In most healthcare systems, 4 main approaches are recognized as scientifically supported. The first is cognitive behavioral therapy, or CBT. This approach focuses on how our thoughts influence our emotions and behaviors. If we can change unhelpful thought patterns and behaviors, we can change how we feel. CBT is practical, structured, and highly researched. It's used for problems like depression, anxiety, obsessive-compulsive disorder, and many others. The second is psychodynamic therapy, which looks deeper into the unconscious mind. It explores how early experiences, relationships, and unresolved inner conflicts shape who we are and how we react today. It's less about quick techniques and more about long-term understanding and emotional growth. The third is systemic therapy, which views problems not just within individuals, but within the systems they're part of, such as families, partnerships, or workplaces. It focuses on patterns of communication and connection and helps people shift how they relate to each other. And the fourth is humanistic therapy, which emphasizes authenticity, personal growth, and self-acceptance. It assumes that every person has an inner potential for healing, and that therapy provides the space and relationship for that potential to unfold. All these forms of therapy might look very different on the surface, but research shows they share something powerful in common: a trusting therapeutic relationship, a shared understanding of the problem, and a belief in the possibility of change. Psychotherapy isn't about telling people what to do. It's about guiding them to understand themselves, to recognize the patterns that keep them stuck, and to learn new ways of thinking, feeling, and acting. And the science is clear: psychotherapy works. It has one of the highest success rates of any medical intervention. People who go through therapy often report not just fewer symptoms, but also better relationships, more confidence, and a deeper sense of meaning. So when we talk about mental health, remember this: a psychological disorder doesn't define you. And psychotherapy isn't about fixing you. It's about helping you reconnect with your own ability to grow, adapt, and heal. Because mental health isn't the absence of problems. It's the presence of resilience, understanding, and hope. And that's exactly what psychotherapy helps to build. Thank you for watching. If this helped you understand a bit more about how the mind works, consider subscribing, and maybe share it with someone who could use a little clarity or a little courage today.